practitioners. It seems certain that the present generation of psychiatric clinicians, skilled in both dynamic psychotherapy and in pharmacological treatment, is an endangered species. What about clinical psychology training programs, the obvious choice to fill the gap? Unfortunately, clinical psychologists face the same market pressures, and most doctorate-granting schools of psychology are responding by teaching a therapy that is symptom-oriented, brief, and hence reimbursable. So I worry about psychotherapy, about how it may be deformed by economic pressures and impoverished by radically abbreviated training programs. Nonetheless, I am confident that in the future, a cohort of therapists coming from a variety of educational disciplines, psychology, counseling, social work, pastoral counseling, clinical philosophy, will continue to pursue rigorous postgraduate training, and even in the crush of HMO reality, will find patients desiring extensive growth and change willing to make an open-ended commitment to therapy. It is for these therapists and these patients that I write The Gift of Therapy. Throughout these pages, I advise students against sectarianism and suggest a therapeutic pluralism in which effective interventions are drawn from several different therapy approaches. Still, for the most part, I work from an interpersonal and existential frame of reference. Hence, the bulk of the advice that follows issues from one or the other of these two perspectives. Since first entering the field of psychiatry, I have had two abiding interests: group therapy and existential therapy. These are parallel but separate interests. I do not practice existential group therapy. In fact, I don't know what that would be. The two modes are different not only because of the format, that is, a group of approximately 6 to 9 members versus a one-to-one setting for existential psychotherapy, but in their fundamental frame of reference. When I see patients in group therapy, I work from an interpersonal frame of reference and make the assumption that patients fall into despair because of their inability to develop and sustain gratifying interpersonal relationships. However, when I operate from an existential frame of reference, I make a very different assumption. Patients fall into despair as a result of a confrontation with harsh facts of the human condition, the givens of existence. Since many of the offerings in this book issue from an existential framework that is unfamiliar to many readers, a brief introduction is in order. Definition of existential psychotherapy. Existential psychotherapy is a dynamic therapeutic approach that focuses on concerns rooted in existence. Let me dilate this terse definition by clarifying the phrase dynamic approach. Dynamic has both a lay and technical definition. The lay meaning of dynamic, derived from the Greek root dynastai, to have power or strength, implying forcefulness or vitality, to wit, dynamo, a dynamic football runner or political orator, is obviously not relevant here. But if that were the meaning applied to our profession, then where is the therapist who would claim to be other than a dynamic therapist? In other words, a sluggish or inert therapist. No, I use dynamic in its technical sense, which retains the idea of force but is rooted in Freud's model of mental functioning, positing that forces in conflict within the individual generate the individual's thought, emotion, and behavior. Furthermore, and this is a crucial point, these conflicting forces exist at varying levels of awareness. Indeed, some are entirely unconscious. So existential psychotherapy is a dynamic therapy that, like the various psychoanalytic therapies, assumes that unconscious forces influence conscious functioning. However, it parts company from the various psychoanalytic ideologies when we ask the next question: what is the nature of the conflicting internal forces? The existential psychotherapy approach posits that the inner conflict bedeviling us issues not only from our struggle with suppressed instinctual strivings, or internalized significant adults, or shards of forgotten traumatic memories, but also from our confrontation with the givens of existence. And what are these givens of existence? If we permit ourselves to screen out or bracket the everyday